It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: high blood pressure in dogs, hypertension in dogs. The symptoms that dogs with high blood pressure present depend on the affected organ. Early signs tend to be asymptomatic, meaning the dog may not show signs of illness. In cases where pet owners notice early symptoms, they are often confused with part of the normal aging process. This is an important reason why high blood pressure is referred to as a silent killer. High blood pressure occurs when the heart has to work twice as hard to pump blood through the bloodstream. Working overtime can significantly affect the heart's efficiency in pumping blood. 1. Types of high blood pressure in dogs. There are 3 types of hypertension in dogs: primary, secondary, and stress-induced hypertension. Primary hypertension is rare in dogs. It can develop without a known underlying cause or in the absence of diseases. On the other hand, secondary hypertension is associated with an underlying health problem. Taking steps to address the problem is an important step. During the measurement process, stress-induced hypertension may appear as a result of excitement or anxiety. Hypertension is more common in older dogs. Kidney disease caused by infection or the development of a kidney abnormality is a major predisposing factor to hypertension in younger dogs. Some of the most common underlying medical conditions associated with high blood pressure in dogs are diabetes, obesity, chronic kidney disease, glomerular disease, endocrine imbalance, hyperadrenocorticism, Cushing's disease, acromegaly, overproduction of growth hormone, adrenal tumor, polycythemia, an abnormal increase in the number of red blood cells in the circulatory system. 2. Are certain breeds prone to high blood pressure? A higher prevalence of hypertension has been observed in certain breeds of dogs, including dachshunds, poodles, some terrier breeds, due to their increased risk of Cushing's disease, schnauzers, Australian terriers, and Bichon Frises because they are more susceptible to developing diabetes mellitus. Sighthounds, especially greyhounds, have higher blood pressure than most dogs. But this is normal for them. Older dogs also tend to have a small increase in blood pressure. Of course, being overweight or obese can also increase a dog's risk of hypertension, regardless of breed. 3. Is high blood pressure harmful to dogs? A major problem associated with long-term sustained high blood pressure in dogs is damage to certain tissues. The main organs that are commonly affected by sustained high blood pressure are the kidneys, eyes, brain, and heart. 4. Symptoms of high blood pressure in dogs. Kidney damage, including decreased function, early kidney failure, protein loss, and bloody urine. Eye damage, including hypertensive retinopathy, retinal degeneration and detachment, ocular hemorrhage, and blindness. Disease of the brain and central nervous system, including encephalopathy, brain hemorrhage, head tilt, disorientation, wobble, partial paralysis, or stroke. Heart disease, including murmurs and left ventricular hypertrophy. Other symptoms that may occur include loss of appetite, lethargy, depression, nosebleeds, and an enlarged thyroid gland. 5. Treatment options for dogs with high blood pressure. The ultimate goal of treating high blood pressure in dogs is to maintain normal pressure. If the dog has secondary high blood pressure, the underlying medical condition must be treated first. Dogs that have developed serious complications associated with hypertension may require hospitalization. Therapeutic nutrition is essential for the long-term treatment of hypertension. Your veterinarian may recommend a change in the dog's diet to one that is lower in sodium. If your dog is taking medications, it is necessary to periodically monitor blood pressure and perform laboratory tests to evaluate the dog's reactions to the treatment regimen and disease progression. As in humans, medication for hypertension in dogs is usually for life. The dosage can be adjusted as needed. Many cases of high blood pressure in dogs have a favorable prognosis when any underlying problems are properly treated with medications and nutrition to maintain normal blood pressure. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.